Here is another skin case. It's called Xanthoma skin. Here at the bottom is normal skin. It's pigmented skin. You could see a nice little layer of melanocytes uniformly throughout the deepest epidermal layers. You could see a stratum corneum. You could see the papillary dermis here between the rete pegs of the skin. And then you could see fairly uniform, well-organized reticular dermis consisting of broad bands of collagenous fibers, fibroblasts, and probably occasional small blood vessels. This is normal skin. Well, let's look at the top. I think you can recognize that skin. I think you could see a stratum corneum here. I think you could see a papillary dermis. I think you could see some remnants of skin appendages. There's a hair follicle. But take a look at the dermis. It's not the epidermis which has the changes of note. The epidermis here is pretty normal. Let's look at the dermis. It does not have uniform bands of dense fibrous connective tissue. It has these little whirly areas of cells surrounding blood vessels, but also freely little globs of cells in which the cytoplasm is very foamy and filled with some foamy material. These lesions are very, very yellow. That's why they're called xanthoma. I believe xantho is the word for yellow. The reason why the cells are yellow and foamy, you might have guessed it already because we've seen it so many other places, is because these cells are filled with fat. Chiefly cholesterol, but other things. In some areas, it almost looks like they are multinucleated, like here. All of these are xanthoma cells. Here's one, here's one, here's one, here's one, here's three or four. Prominent foamy cytoplasm filled with fat, cholesterol as well as other fats. I think cholesterol is the chief fat, though. And xanthomas are very, very often associated with serum lipid abnormalities, usually increases in serum lipids, cholesterol, and triglycerides. And this is a classical appearance of a dermal xanthoma. And thank you very much.